How are you?
Hi.
Doctor?
Hi, how are you?
Dylan Gressick. You
Nice
performed
to meet
on me in 2003.
2003?
Yes, at University of Chicago. So you performed an ASD closure on me in 2003.
Let me pull the information right now. Dylan Gressick, G-R-E-S-I-K.
That's me.
Male. This is your medical record number. This is your date of birth, 1997. Procedure date, 6/26/2003. So the patient comes in, they're awake, alert. We puncture the vein in their groin. Then we go with a catheter and a camera all the way until you are inside the right atrium. Then we put the camera in the right atrium and it gives you a panoramic view of the wall and the hole in the middle. Then I do measurements, then decide what size umbrella or device I use to close this. Then we take it and we just patch it there, and it's just fantastic procedure.
There's moments that people have that they see a different perspective on life and say, okay, you know, we really only have one life to live. And I think I was fortunate enough to be young and have that sort of moment that he repaired it, and it's been smooth sailing since, but it could have gone undetected, it could have gone undiagnosed, and I was fortunate to have that level of care.
When I was in Chicago in 2000, I started a program allowing families to be in the room with their loved one, because it creates so much comfort to the patient. They're not anxious. And if I'm confident, why I cannot allow the family? Why not?
So my mom was in the room with me, and I didn't even realize that. I mean, I was young, that wasn't a standard thing, but I think, you know, that is, her being there next to me throughout the entire procedure is something that definitely does stand out, and I think contributes to that. It's a positive memory, it's not something traumatic.
Yeah.
As well as obviously it's so minimally invasive that I don't even have scars on my
No, I
legs
would
or
not have
anything.
any scar. I mean, I
There's-
can tell people after a few months, look there. Do you see anything? They say no, it's magic. It's
Yeah,
real, you know?
so there's no scars there. I mean, it's not like you're cracking the chest or anything, which can obviously be traumatic for young children. So I think that's why that has contributed to why I've always looked at it as something that's been so positive in my life, and such actually a cherished memory rather than something that I don't want to think of, for sure.
It is emotional to see a patient, a young person now after all these years, no contacts, and then shows up here. You've done me in 2003, and you see him healthy. It's really brings the whole message home that that's why we are in medicine, because especially in pediatric cardiology, you take care of kids from fetus up to 90 years of age, some of my patients. And this is for all. It's amazing, you know. This is why we are in this profession. When you do a patient and they're small, and then years later they come and they're adults, and it's the most gratifying thing that we do in our lives.
Yeah.
I have patients now, they are in their 30s, 40s, and all of this.
Yeah. Thank you so much.
Then good to see you, buddy. Good to see you.